Do you know the best order to take your pulmonary medication? Understanding this sequence is not just about ticking boxes or following a routine. It's about optimizing your therapy and pulmonary rehabilitation, and here's why. When it comes to pulmonary rehab, the order in which you take your medication plays a crucial part. It's a well-thought-out sequence designed to tackle your respiratory issues in a systematic and effective manner. Starting with short-acting beta agonists, or SABA inhalers, they provide immediate relief during acute episodes. Then, long-acting beta agonists come into play, helping maintain open airways for more extended periods. Next, corticosteroids address the root cause, inflammation. Lastly, if needed, systemic steroids provide comprehensive relief. This order isn't arbitrary. It's a strategic plan that sets the stage for the most effective therapy. Remember, getting better isn't just about taking the right medication, but also taking it in the right order. The right sequence sets the stage for the most effective therapy, starting with short-acting beta agonists, or SABA inhalers. These inhalers, such as albuterol, levolbuterol, and terbutaline, are your first line of defense in a pulmonary rehab regimen. Imagine being in a crowded room where the exits are blocked. It's difficult to breathe, right? This is similar to what happens during an asthma attack or a COPD flare-up. Your airways narrow down, making it hard to breathe. This is where SABA inhalers come into play. Acting like a crowd controller, they open up these exits, or in this case, your airways, providing rapid, quick relief when you need it the most. It's like having a personal rescue team on standby, ready to swoop in and save the day at a moment's notice. So, when you feel an attack coming on, remember to reach for your SABA inhaler first. Remember, SABA inhalers are your initial quick relief. Once your breathing stabilizes, it's time for long-acting beta agonists, or LABA. These are the marathon runners of the medication world. They're not about the sprint, they're about the long haul. LABA inhalers, which include salmeterol, formoterol, and indacaterol, provide sustained relief for your lungs. They're like a gentle, steady hand, keeping your airways open for an extended period. Think of them as your lungs' best friend, always there providing support, promoting better lung function. They work quietly in the background, allowing you to breathe easier for longer. With LABA inhalers, your lungs get the space and time they need to heal and strengthen. So remember, after the immediate relief of SABA comes the long-term support of LABA. They're the second step in your medication regimen, an important part of your journey towards better breathing. LABA inhalers are your next step, offering sustained relief. Next, let's tackle inflammation with corticosteroids. These medications are the heavy lifters in your pulmonary rehab routine. Corticosteroids, including budesonide, fluticasone, mometasone, and beclomethasone, are designed to address the root cause of most breathing issues, inflammation. They do this by reducing the swelling and irritation in the walls of the small air passages in your lungs, making it easier for you to breathe. But their role doesn't end there. They're also proactive, working to prevent future flare-ups and attacks. It's like having a personal bodyguard for your lungs, always on the watch, ensuring your airways remain clear and inflammation-free. Corticosteroids are not quick fixes, but rather an essential part of your long-term treatment plan. They help create a stable, healthier environment inside your lungs, allowing you to breathe easier day in and day out. So remember, corticosteroids are key to managing underlying inflammation. Finally, if necessary, consider systemic steroids. These are not your everyday medications, but are reserved for severe flares or exacerbations. Oral medications like prednisone, methylprednisolone, dexamethasone, and triamcinolone work systemically, meaning they address inflammation throughout the body, not just in your lungs. Now let's summarize why this order matters. First, we have the short-acting beta agonists, your quick relief soldiers, ready to open up your airways at a moment's notice. Followed by the long-acting beta agonists, your long-term protectors, keeping your airways open for extended periods. Then, we introduce the corticosteroids, your inflammation fighters, tackling the root cause of your symptoms. And lastly, if necessary, the systemic steroids come into play, offering comprehensive relief during severe episodes. Remember, This order is crucial for immediate relief, sustained benefits, inflammation control, and comprehensive relief. It's a journey, but with the right approach, you can optimize your medication regimen for better lung health.